Understanding Commercial Sex Policy, a Global and U.S. Perspective. This presentation is brought to you by Ivania Grenier, Bianca Fields, Jesse George, Jessica Jones, Kendra Lamb, Elizabeth Ortega, Humberto Ortiz, and Kelly Ulloa. Commercial sex is prohibited. This concludes our presentation with references available for your review. Some anticipated questions in regard to a potential bill include how a commercial sex decriminalization bill would impact costs and quality of care for sex workers based on special insurance options. Also, how decriminalization may affect sex workers and their clients in terms of safety and violence. What are potential nursing implications of prostitution decriminalization in the U.S. brothels? Which issues may require additional costs? In order to answer these questions, it is critical to survey and conduct interviews with the groups involved in commercial sex industry with the aim of creating an in-depth understanding of the issue. Some anticipated questions include: is there current research that evaluates commercial sex impacts on health, access to care and services, costs, and quality of care? Also, what are the advantages and disadvantages of having brothels with regulated prostitution in the U.S.? Does there exist effective policy for which legislation can be modeled? What are the barriers, limitations, and other concerns encountered by nurses in their care for sex workers, such as STDs, intimidation, fear of arrest, and psychological traumas? Liberals, unions, sex workers, sellers, political advocacy groups, Amnesty International, and the World Health Organization support the idea of decriminalizing commercial sex. The supporters of the proposed bill about decriminalization would provide such arguments as making sex workers safer and eliminating abuse and discrimination. These groups claim that prostitution is work, and like any job, it should guarantee certain rights and legal benefits. Its abolitionists are the majority of feminists and conservatives who believe that commercial sex is offensive by its nature and causes inequality between men and women. They view prostitution as an exploitative exchange that brings no positive issues to sex workers. Therefore, Congresspersons and Senate representatives with liberal views should be targeted as policymakers who can affect the development and introduction of the proposed bill. In order to follow the money, it should be stressed that the introduction of a new policy may require significant spending from the government and local organizations, but its expected outcomes seem to be much more important. If the given issue remains unaddressed at the government level, there is a risk of increased incidence of STDs, client violence, and vulnerability of the sex worker due to fear and the inability to seek health assistance. These unintended consequences would likely manifest as additional burden to healthcare costs. Moreover, the human rights of sex workers may be violated as they would continue to have poor access to care and fear being arrested. If the Nordic model were to be applied, clients would still be illegal, which may affect the profits of sex workers as well as their ability to pay for housing and other lively needs. Additional unintended consequences of decriminalization commercial sex may be the increased number of brothels and sex trafficking through intimidation and coercion. The groups that may be affected are sex workers, clients, nurses, and the members of society with an active position regarding the given issue. If sex workers continue to maintain poor access and limited rights, they would be deprived of basic rights of education, pursuance of adequate pay, and livelihood. These clients would be stigmatized and repressed, leaving fewer opportunities for these women. Nurses would be overwhelmed with addressing STDs and potential psychological traumas. Increase in demand for brothels and sex trafficking may also affect women engaged in this service. Since there does not exist a current proposal of broad legislation with regard to commercial sex, it is possible to hypothesize the potential scope. First and foremost, it should be stressed that the issue is extremely complicated, stigmatized, and multifactorial, which makes sweeping policy difficult to achieve. One may assume there is a need to research all states and identify the attitudes of its constituents, survey the number of brothels existing illegally, and conclude with a clear vision of each of the states. The example of Nevada, where only indoor commercial sex is legalized, seems to be effective, as sex workers are protected from violence, have a negotiating process, and periodical health checks, which is sufficient to address the problem. Therefore, partial legalization and decriminalization may be discussed as potential legislative agendas in the U.S. context. The funding would be provided by both government and local authorities. Prohibited in the US and many countries worldwide due to its perceived moral, physical, and psychological damage. However, a range of scholarly studies report that punitive measures are not effective, and there is a need to reconsider policies regulating the work of the industry. For example, a Nordic model of managing prostitution criminalizes the buyers of the service, yet decriminalizes those who provide it. According to SEALS, this model sets no health requirements, which is a health concern that makes many sex workers unprotected. In its turn, the analysis of Nevada, where indoor sex commerce is legalized in 11 counties, shows that women have more opportunities to check their health. This policy requires them to use mandatory condoms, check for syphilis and other STDs, and live in a brothel while working. Thus, while the issue was not addressed by the government, nursing profession contributes to its resolution via the aforementioned policies.